The first symptoms may be only a mild tingling or numbness or a slight loss of feeling in your feet or legs. But as the damage grows, it's easy to lose your balance. It's easy to fall and hurt yourself. Eventually, peripheral neuropathy can get so bad it can land you in a wheelchair. This kind of problem is especially dangerous because early on there may be no pain. And without pain to tell you something is wrong, you may not realize you're dealing with a problem that can cause you harm and destroy your life. You're about to discover what may be happening to your nerves, why you're at risk, and how to get out of harm's way. This is Dr. Phil Straw, and I first want to tell you about Audrey. She was one of my patients. At 71 years young, before the pain started, Audrey was happy and full of joy. She hadn't lost a step. In fact, she was busier and more active than ever. Then it started. At first, just a little tingling and numbness, then a burning sensation, then pain. As the nerve damage progressed, the pain grew worse. Eventually, Audrey's hands and feet were on fire. The pain took over. It dominated her life. It was all she could think about. As the creeping nerve damage that caused the pain to grow, Audrey's life began to change, and not for the better. She had always been active. Now she was restricted. She had to sit aside so many things she enjoyed. She felt like she was being punished. Audrey loved writing in her journal. She'd done it every day for years. Now her hands hurt so badly she had to give it up. Writing was just too painful. As the pain in her feet and legs grew, it hurt to walk. That's why she gave up on the long walks and hiking with her friends. Her world was growing smaller. And the cruelest cut of all, Audrey could no longer do the one thing that she loved doing most in her life. Her feet and legs hurt so bad she couldn't dance. She couldn't go out on the dance floor, shake a leg with friends, and teach students the way she had for years. Audrey desperately missed dancing. She desperately missed her friends. She missed writing in her journal. But over time, the pain just took over. At first, the tingling and numbness was hardly noticeable. She lived with it for months before she even mentioned it. And now here she was. Audrey was a prisoner in her own body. No longer able to enjoy a normal life, Audrey was essentially homebound, hurting and growing more depressed every day. Of course she went to the doctor. The doctor diagnosed Audrey's condition as peripheral neuropathy. Peripheral neuropathy is when tiny nerves in your hands, arms, feet, or legs stop working properly. A mild tingling, numbness, or loss of feeling in your hands, toes, or balls of your feet are often the first noticeable symptoms. Common symptoms include tingling and numbness, mild loss of feeling in your hands or feet, inability to feel your feet, which makes walking dangerous and puts you at risk for falls and injury. Some people describe it as walking on marshmallows, marbles, or pins and needles. Other common symptoms include loss of coordination, dexterity, which puts you at an increased risk for accidents of all sorts, inability to feel clothing like socks or gloves, painful muscle cramping, and leg spasms. These can happen in the middle of the night or any time during the day. But cramping, burning pain, all these things can happen with neuropathy. It increases your risk of falling, which makes a simple walk through the house a potentially dangerous activity. Pain which can become so bad it's all you think about. When a nerve stops working properly, signals from the brain don't reach the cells. It's like static on a phone line. As the cells surrounding the nerve lose their connection to the brain, the cells can't function properly. As the nerve damage progresses and the nerve begins to die, cells surrounding the dying nerves begin to die too. Now here's the scary part. Nerve damages cause cell damage. Cell damage speeds up nerve degeneration. Without treatment, this can become a downward spiral, and the process accelerates. The damage can get worse fast. It's different for everybody, but some people can get severe damage in a matter of just a few months. Other people, it can take several years. Mild symptoms may intensify. Slight tingling, numbness, or lack of feeling is replaced by pain. Before you know it, the damage can become so bad you hurt all the time. Unless this downward spiral is stopped and the nerves return to proper function, the nerve and cell damage in the affected area can get so bad your muscles begin to die right along with the nerves and cells. If you have early warning signs of peripheral neuropathy, it's critical you get proper treatment. It's critical because with proper treatment, the symptoms can often be reversed. The tingling, numbness, or loss of feeling and burning or pain can stop, and you can come out smelling like a rose. Ignore the early warning signals long enough and you risk progressive nerve damage leading to muscle wasting, severe pain, loss of balance, and a lot of staying at home wishing you didn't hurt. When every step is like walking on hot coals, sitting still may be all you feel like doing. but there's little joy in sitting all day long. As the condition progresses without proper treatment, your muscles begin to die from the inside out, and that hurts. A best way to describe peripheral neuropathy is creeping nerve death. A big problem with peripheral neuropathy is first symptoms are often so mild. A little tingling or numbness may be all you notice, but over time, weeks or months, possibly longer, the tingling or numbness grows. Eventually, it's impossible to not notice it. Painful muscle cramps and muscle spasms, loss of balance, fear of falling, all this and more is common symptoms as it progresses. Then over more time, slow or fast, depending on the person, the burning starts. The pain churns on and the suffering begins. Without proper treatment, this condition can destroy your quality of life and even land you in a wheelchair and make you completely dependent on others. It's not a pretty picture. So what causes peripheral neuropathy? Peripheral neuropathy is caused by inflammation, and that inflammation may be caused by a variety of things, including injury, diabetes, pre-diabetes, those are the most common ones, chemotherapy, certain medications you take, a poor diet of junk food and refined products, and statin medication prescribed to lower cholesterol can also cause nerve damage. And many, many other things can cause chronic inflammation. The key to know is without treatment, the initial symptoms of tingling and numbness may progress into burning sensations, pain, inability to sense hot or cold, loss of coordination, muscle weakness, muscle cramps and spasms, and flat out making it difficult to walk. Increased risk of falling, and ultimately complete loss of muscle control. Not a good situation. The doctor diagnosed Audrey's condition as peripheral neuropathy. He said peripheral neuropathy is common in older people. He said there was no treatment he could recommend, so just go home and take it easy. Take it easy is code for stop doing what you love. Sit still and hope it gets better. Audrey left the doctor's office with a prescription for pain pills and with sage advice to check back in a few months if things didn't improve. They left out the most important part. They never told her, number one, that her nerve damage and dying cells do not magically heal on their own. They need help, and not the kind medical doctors typically provide. And number two, they never told her about a new treatment protocol being used with great success to reverse symptoms, relieve pain, and help restore healthy nerve function. In my clinics alone, we've had wonderful success. We've helped over 5,000 people get relief from their neuropathy. And number three, they didn't tell her that pain pills do nothing to restore healthy nerve function. They just mask the pain as the nerves continue to degenerate and cells die. Why leave important things like this out? Simple. Medical doctors are bound by something called standard of care. Standard of care refers to what is well known and commonly accepted by most doctors. So if the treatment is not well known and commonly accepted by most other medical doctors in the community, it is not considered an option. And even without standard of care restrictions, doctors are busy. They barely have time to keep up with their area of expertise, much less keep up with new treatments, new technologies, and advancements outside their area of expertise. Audrey made a decision. She wasn't about to become homebound and dependent on others, so she accepted full responsibility for getting better. She didn't want to manage anything. She wasn't about to play prescription roulette. Nerve damage was bad enough. The last thing she needed was liver and kidney damage caused by overusing pain pills. Audrey wanted her life back. She wanted the pain to go away naturally. She wanted to get back to hiking and dancing and writing and living the life she loves. So instead of taking it easy and taking pain pills, she learned about her condition and decided to find someone that's dedicated themselves to helping people with neuropathy. That's when she found us. And that's when she discovered over the last 5 years we've helped over 5,000 people suffering with symptoms of nerve damage just like hers. When Audrey learned about our unique treatment protocol that took years of research and hundreds of hours of clinic time to develop and perfect, she was all in. Yes, it takes multiple treatments. Yes, it's time consuming. Yes, it costs money. But for Audrey and the thousands of others it's worked for and worked well, it was worth it. Here's Audrey's story in her own words. When I first came to Optimal Health, my hands were so bad that I could not write, and the pain was so shocking it made me cry. The pain in my feet prevented me from correctly walking, hiking, dancing, etc. And then after she completed treatment, she said this, "I can now write again and walk normally. I teach dance, so I need my hands and feet to function. Good news, I am able to dance with my students again. I no longer need a demonstrator. I can do it myself. Exclamation point. Was this the best outcome for Audrey? Consider the following and decide for yourself. As happy as you may be for Audrey, and as well as she did with the optimal neuropathy treatment protocol, with it reversing Audrey's symptoms and giving her life back, wouldn't it have been better if she never suffered any agony and endured the helplessness and the screaming pain? Wouldn't it just been better if she would have treated sooner, if she would have found us sooner and got to her office and got the proper care? If you agree Audrey would have been better off if she discovered this sooner so she could have avoided all the suffering, then please consider Audrey's story a wake-up call. Not long ago, you were concerned enough to come to my office, to come to Optimal Health Clinic for an evaluation. During that evaluation, they found evidence of nerve damage. We recommended a treatment program to reverse your symptoms and help restore the natural function of your nerves. And you decided not to treat at that time. My concern is that without proper treatment, you put yourself in harm's way. Without treatment, you risk your symptoms getting much, much worse. Eventually, those tiny symptoms can explode and land you in screaming pain and even dependent on others. Audrey is one of my favorite patients. I love telling her story, but it would have been so much better if Audrey had found us sooner and treated sooner. The optimal neuropathy treatment protocol pulled Audrey out from the depths of hell. It rescued her from her pain and gave her life back. It was a huge success. But still, it breaks my heart that she suffered so badly, and it breaks my heart again to find that she didn't treat sooner and could have avoided all the pain. If you and I were face to face right now, you could look me in the eye and know that I'm on your side. You would know that I have your best interests at heart. And that is why you received this letter. I want you to be happy and excited about life. I want you to enjoy every day. But as a doctor who has dedicated to helping thousands and thousands of people with neuropathy, I know that can never happen as long as a slow creeping nerve damage is killing your nerves and your cells and your muscles in your arms, legs, hands, and feet. Audrey's first symptoms was a little tiny tingling and numbness. Over time, those symptoms exploded into pain and made her a prisoner in her own body. Please don't go there. There's no need to put your freedom, your mobility, and quality of life at risk. You have a choice. You can get out of harm's way. You can take the target off your back. So here's the situation. Damaged nerves, the ones that cause your symptoms, do not magically heal themselves. Without proper treatment, nerves continue to degenerate until one day the damage is so bad it hurts to move and the pain takes over your life. To date, the Optimal Health treatment protocol has helped over 5,000 people reverse the symptoms of nerve damage and get out of pain. And I'm here to help. I'm ready, I'm willing, and able. Now you're at a crossroads. You can do nothing and the odds are against you. Not getting proper treatment puts you at risk, and the risk increases every day. You may already be on borrowed time. If you could see through my eyes and know the kind of life-altering, painful nerve disease can cause, you'd move heaven and earth to start treatment. Nothing could keep you from it. But you can't see through my eyes, so I've done my best to give you the information you need to make the right decision. All I ask is whatever you do, please do what you honestly believe is best for you. After all, it's your life. No one will feel the devastating pain of progressive nerve damage or the joy of health, vitality, and life without restriction more than you. This is about the quality of life. It's about your health, your happiness, your freedom, your independence, your mobility. This is about you. So deciding to accept treatment you need so you can stay active and enjoying your life should be your choice. Everyone who loves you should give you their enthusiastic support. They should applaud your decision and your courage for doing what you believe is best for yourself and for taking steps to get yourself out of harm's way. Based on mountains of research and years of experience helping over 5,000 patients, my advice is to contact my office as soon as possible and get started on my proven treatment protocol right away. Your next step is simple. Just pick up the phone and call my office. When you get someone on the phone, tell them you received my letter and you're ready to come in to discuss starting treatment. And by the way, please don't let whatever stopped you from accepting treatment earlier be an obstacle. If you have symptoms we discussed in this letter and want treatment, just call. I promise you we will do everything possible to help you get the treatment you want and have the confidence and peace of mind to know you made the right decision. One more thing. We recently added some new finance options and payment plans that make it easier to finance your treatment and make payments. If you want financing, be sure and ask about these new financing options when you call. Financing treatment you need has never been easier. Just call. I wish you all the best, and God bless.